Hello, my dear friends, uncles, aunts, and beloved viewers of the channel Living Healthy with Vân Vân. I am a doctor, now over 50 years old, with more than 30 years of experience accompanying patients. There's one question I hear very often in the clinic. Doctor, I have a dull headache, heaviness in the forehead, nasal congestion, but sometimes it also feels like stabbing pain on one side. Do I have sinusitis or migraine? This is a very common concern. In fact, sinus headaches and migraines share many similar symptoms, which makes them easy to confuse. Distinguishing between them is extremely important, because the treatment for each is completely different. Today, I invite you to explore together. What is a sinus headache? What is a migraine? Why are they so often mistaken for each other? And how can we recognize them correctly? And one more thing I've realized, many people underestimate their headaches, thinking it's just from lack of sleep, stress, or changes in the weather. But in reality, headaches can be a warning sign of something more serious, including cerebral ischemia, poor blood supply to the brain. So, let's also discuss, what is cerebral ischemia? How is a headache from cerebral ischemia different from migraine or tension headaches? Most importantly, how can we treat and prevent it, so we don't have to live with constant pain? What is a sinus headache? A sinus headache is caused by infection, blockage, or pressure in the sinuses around the nose and forehead. The sinuses are hollow spaces inside the skull that lighten the head and moisten the air we breathe. When sinus infection occurs, the lining swells, pus builds up, pressure increases, and this creates the typical sinus headache. Patients often describe it as, I feel heaviness in my forehead, pain worsens when I bend forward, and it comes with nasal discharge. What is migraine? Unlike sinus headaches, migraine is a neurological disorder, linked to abnormal dilation and constriction of blood vessels in the brain and imbalance of neurotransmitters. Key symptoms: severe throbbing pain, usually on one side of the head. Nausea, vomiting, sensitivity to light and sound. Attacks lasting from 4 hours up to several days. What causes confusion? Many migraine patients also complain of nasal congestion and runny nose, making them think it's sinusitis. Why are they often confused? 3 main reasons. Location of pain. Both affect the forehead, around the eyes, and cheeks. Nasal symptoms. During migraine, the sympathetic nervous system can cause nasal congestion and runny nose. Triggered by weather. Both can flare up in cold or changing weather. I once had a patient who suffered migraines for 10 years, thinking it was sinusitis. He took countless antibiotics without relief, until he was correctly diagnosed, and only then did treatment work. Distinct symptoms of sinus headache. Remember these 5 key signs: pain and heaviness in forehead, cheeks, around eyes, or nose bridge. Worsens when bending forward or lifting heavy objects. Comes with nasal congestion, thick yellow, green discharge, bad breath. May include fever, fatigue. Pain persists until sinus infection is treated. Distinct symptoms of migraine: one-sided, throbbing, hammer-like pain. Nausea, vomiting, sensitivity to light and sound. Lasts 4 to 72 hours. May include aura, flashes of light, blurred vision, tingling before pain starts. Not directly linked to sinus infection. Key comparison. Characteristics. Sinus headache. Pain location: forehead, cheeks, around the eyes, nose bridge. Nature of pain: heaviness, dull ache, worsens when bending forward. Accompanying signs: nasal congestion, discharge, fever. Duration: continuous until the sinus infection resolves. Response to treatment: improves with antibiotics and nasal sprays. Migraine. Pain location: usually one side of the head, temple area. Nature of pain: throbbing, severe, hammering. Accompanying signs: nausea, sensitivity to light and sound. Duration: 4 to 72 hours, recurring in episodes. Response to treatment: improves with migraine-specific medications. When to seek medical help immediately. See a doctor right away if sudden severe headache, like thunderclap. Headache with weakness, slurred speech, right pointing arrow, possible stroke. Headache with high fever, stiff neck, projectile vomiting, right pointing arrow, possible meningitis. Headache lasting weeks despite treatment. Treating sinus headaches: antibiotics, anti-inflammatory drugs, nasal sprays. Steam inhalation, saline rinses. Endoscopic sinus surgery for chronic cases or polyps. Prevention: keep sinuses clear, avoid dust, stay warm, drink water. Treating migraines. Pain relief, paracetamol, NSAIDs, triptans. Preventive medications for frequent attacks. Lifestyle, adequate sleep, regular meals, stress control. Avoid triggers, alcohol, coffee, chocolate, bright lights. Healthy habits for both conditions. Fresh, clean environment, avoid smoke, dust. Stay hydrated, eat more vegetables. Sleep well, avoid late nights. Exercise regularly. Manage stress with yoga, meditation, or walking. I recall one patient, Mr. Hung, 55 years old. For 7 years, he thought he had sinusitis, forehead pain, nasal congestion. He tried countless medicines, even sinus surgery, but pain persisted. Only after careful examination, we discovered he actually had migraine. Just a few months of proper treatment, good sleep, and deep breathing exercises, and he said, "Doctor, I realize I've been fighting the wrong enemy all these years." What is cerebral ischemia? Cerebral ischemia, poor blood circulation in the brain, means the brain doesn't get enough blood supply. Though the brain is only 2% of body weight, it consumes 20% of oxygen. When blood flow decreases, nerve cells cry out immediately. First and most common sign, headache. But also, dizziness, insomnia, poor concentration, memory loss, fatigue, tinnitus, numbness. I had a 58-year-old female patient, frequent dull headaches, painkillers only gave temporary relief. Tests revealed cerebral ischemia from carotid atherosclerosis. Without early detection, she could have suffered a stroke anytime. How is ischemic headache different? Migraine, one-sided, throbbing, with nausea, sensitivity to light, lasts 4 to 72 hours, then resolves. Ischemic headache, dull, widespread, not just one side, often with dizziness, tinnitus, memory decline, triggered by stress, weather changes, or standing suddenly. I often tell patients, migraine is like a storm that comes and goes. Cerebral ischemia is like steady, soaking rain that lingers. Why more common after age 40 to 50? Atherosclerosis. Cholesterol plaques narrow brain arteries. Cervical spine degeneration. Compresses vertebral arteries. Blood pressure instability. Both high and low affect brain flow. Plus, stress, sedentary lifestyle, smoking, alcohol. Early warning signs of cerebral ischemia. Morning headaches, head heaviness. Dizziness with posture change. Insomnia, frequent waking. Poor concentration, forgetfulness. Tinnitus, brain fog. These are SOS signals. Ignoring them risks stroke or early dementia. When is it dangerous? Seek immediate care if sudden, severe, first ever headache. With slurred speech, facial droop, limb weakness, right pointing arrow stroke. Lasting weeks, not responding to painkillers. With fever, stiff neck, right pointing arrow, meningitis suspected. Principles of treating cerebral ischemia. Address root cause. Improve circulation with prescribed drugs. Control underlying conditions. Blood pressure, diabetes, cholesterol. Lifestyle. Enough sleep, regular exercise, stress reduction. One of my 62-year-old male patients improved remarkably after 3 months of quitting smoking, exercising lightly, and taking prescribed medicine. His headaches reduced, memory improved, proving the brain can recover if we give it a chance. Habits to reduce ischemia risk. Balanced diet, less animal fat, more fish, vegetables, whole grains. Hydration, limit alcohol. Walking, breathing exercises, yoga. Regular monitoring of blood pressure, sugar, cholesterol. Go to bed early, avoid late nights. Common mistakes. Only taking painkillers without finding the cause. Buying brain supplements of unknown origin. Thinking headache is just part of aging. This is dangerous. Untreated cerebral ischemia silently progresses to stroke. Key message. Headache is the body's language. Instead of masking it with painkillers, we must listen and find the real cause. If it's cerebral ischemia, it can be improved with proper medication and lifestyle changes. Final words. Dear friends, sinus headache and migraine are two very different diseases, yet often confused. With the right distinction, treatment becomes effective, and quality of life improves. Please remember, if headache comes with congestion, fever, yellow, green discharge, right pointing arrow, think sinusitis. If sharp, throbbing pain with nausea and light sensitivity, right pointing arrow, think migraine. If unusual symptoms appear, don't self-diagnose, see a doctor. Health is the most precious gift. Don't let silent headaches steal away your joy of living. Thank you for joining me in today's talk. I hope this video helps you better understand how to distinguish headaches, sinus, migraine, and cerebral ischemia, and how to treat them. If you find it useful, please share it with your family and friends, so we can all prevent these dangerous conditions. Wishing you health, clarity of mind, and peace each day.